So about 2 years ago, I had my first encounter with plantar fasciitis. Now, if you're familiar with the sharp stabbing heel pain that greets you first thing in the morning, then you're well aware of the joys of plantar fasciitis. And the ironic part is that I'm a physical therapist and I've treated a ton of people with heel pain, plantar fasciitis, and all sorts of foot and ankle injuries. So when I first started to experience plantar fasciitis myself, not only did I want to get rid of it as fast as possible, but I wanted to take my strategies and I wanted to use that to help my own patients. But there was one problem. Would my treatment recommendations actually work for me? Could I figure out how to resolve heel pain for myself? And if not, I would feel like a total fraud just limping around the clinic as a physical therapist who couldn't treat his own heel pain. So I started at the beginning and I performed kind of a mini evaluation, if you will. Now, during a typical PT evaluation, you want to learn about the patient's past medical history, their activity level, and then like the cause of the injury if possible. But for me, the problem really started when I bought a new pair of shoes, and then I failed to do the one thing that I now recommend all my patients look at. You see, the problem with most new shoes is the cheap piece of foam that they call an insert. Now, unless the shoe is specifically designed to provide arch support and stability for your heel, you might as well be walking on flip-flops all day. Now, as a PT, I can wear athletic shoes in the clinic, and that's just where my problem started. I had just bought a new pair of athletic shoes, and I threw them on straight from the box and wore them all day in the clinic for a week. Since I like to be active with my patients, I move around and I perform a lot of the exercises with them throughout the day, and that's when the pain along the inside of my arch and the heel started to flare up. When I first started to get the pain in my heel, I began to do a few calf stretches and then some other exercises to help strengthen my foot muscles, but then I realized the root cause of the issue had to do with my footwear. For a lot of people too, this reason that they're experiencing plantar fasciitis may be due to a change in activity level or their footwear, or even physical factors like age and weight. Now, don't get me wrong, doing exercises and stretches when you have plantar fasciitis is proven in the long term, but in the short term, I wasn't thrilled with the idea of just buying another pair of shoes. So I removed the inserts from my shoes and then I added a semi-custom shoe insert from Tread Labs, and I've been using them for the past 2 years. In fact, I upgraded recently to the new Pace insoles from Tread Labs, and now I have different insoles in different pairs of shoes that I wear throughout different activities. But the point is, after adding the insoles to my shoes, I was able to continue with some stretches and exercises for the next 2 weeks. My plantar fasciitis went away completely and it hasn't returned. For me, it just reminded me of the importance of our footwear and how we just can't rely on a shoe brand to make shoes that could possibly meet the needs of everyone who's wearing them. So now anytime I buy shoes, I want to always make sure that they have a removable insert so that I can add a supportive insole like a Tread Labs insole if I need to. Look, even as physical therapists, we can experience aches and pains like everyone else does, but I hope you realize the importance of identifying the root cause or the key contributors that could be causing your plantar fascia to become irritated in the first place. For me, and for a lot of people out there, the problem can be traced back to footwear. And after experiencing and resolving plantar fasciitis for good, I always make sure that my shoes have the right support. You can see the inserts that I'm currently wearing by clicking the link in the description below, or go to ptprogress.com/treadlabs to see their full lineup of inserts that I recommend to my patients. Thanks for watching, and we'll see you in the next video.